Good afternoon, everyone, and welcome to using tracking data to inform health impact assessment. I'm Sandra Whitehead. I'm with the National Environmental Health Association. Just a little bit about NEHA. NEHA is the Association for Environmental Health Professionals around the world and around the country. We have about 4,800 members. We offer 7 different credentials, and we have 6,200 credential holders across the 50 states and in 2 territories. We publish a Journal of Environmental Health 10 times a year, and we have trained about 3,500 people over the last 2 years through our webinars. Today, we have a great webinar for you, and we're going to have speakers from Massachusetts, Minnesota, and Florida talk about their use of environmental public health tracking data to inform their health impact assessment practice. Our first speaker is going to be Margaret Round from Massachusetts. Margaret?
Hi, Sandra. Can you hear me?
Yes, thank you.
So I'm on now, and here's my first slide. Sandra, is that correct?
Yes, ma'am.
Okay, great. Hello, everyone. Good afternoon. Good morning to others that are. I'm going to talk about the public health tracking data for health impact assessment and work that we did with the National Environmental Public Health Tracking Work Group. Just a couple slides to introduce health impact assessment. As many of you probably know, so most of this is just a brief review. Health impact assessments address a multitude of determinants of health, and they ask the question, how does the proposed project, plan, or policy affect many different areas of health and lead to health outcomes? Health impact assessment is a process that uses a variety of data sources and analytical methods to consider input from stakeholders and consider input from stakeholders to determine the potential effects of a proposal on health of the population and the distribution of those effects within the population. And in this slide, I have just summarized the advancements that have been made in health impact assessment guidelines and practice over the last several years. In the interest of time, I'm not going to go through each one, but I will certainly provide the links to this. But I would just highlight that Society of Practitioners of Health Impact Assessment, SOPHIA, is a wonderful organization that I hope that you would consider joining if you're interested in this area. But the bulk of the work that's really been done here in the United States and supported by nonprofit organizations are health impact assessments that have been conducted. And here is a map that shows the completed and in progress HIAs as of 2018, thanks to Bethany Rogerson at Health Impact Project. So there are, as you can see, 414. The last time that I looked, which was in 2012, at a similar map, there were 103 completed and 89 in progress. So there's been about a doubling since then. So the steps of the HIA are a systematic approach to looking at the screening to determine the need of an HIA, scoping, assessment, recommendations, reporting, and monitoring. And for the environmental health work that I've been involved in and I want to share and focus on today is in the assessment side, where we actually look at existing health conditions and what data sources are available for that. So the key components of the steps of the HIA are that the stakeholders that are affected by the decision are empowered to shape the nature and scope of the HIA from the beginning of the process. And this is really probably the most important thing about an HIA, is that the people who are affected are involved and we actually get information from them. And the baseline health and environmental assessments that's embedded in the methodology provide disease burden in the community, the social determinants of health, and the environmental conditions. And then the recommendations, of course, need to inform ways that the decision can improve health and not necessarily and not at all stop the process, I should say. So as many of you know, the Environmental Public Health Tracking Program has been around now for, I guess, going on 18 years, and from the first funding. There are 25 state and local grantees, and they've done a tremendous amount of work, including over 340 public health actions. I've been involved in it from the beginning. It's been a really incredible process. The content areas of tracking, as you can see here, encompass environmental, exposure, health effects, and population characteristics, and these have been expanding over time and are strong evidence-based data sets. They're readily available, and they can form community and county-level environmental indicators. And this is really forms the basis for their use in health impact assessment. So we have formed a work group for the National Tracking Network, and I really want to give a shout-out to the folks at CDC Environmental Public Health Tracking who were involved in spearheading this effort, agreeing to it, working with us, providing the foresight and resources, and also to Chuck Strobel, who co-chaired and actually really brought this to completion. So we focused on the states there that are listed were part of this work group, and we focused on increasing awareness of the network, utilizing data and developing case studies, and evaluating and recommending enhancements to the network as it could support health impact assessment. So the data essential to inform the HIA process are, as far as ETHT data is concerned, is for the scoping, assessing, and then monitoring and evaluation. The challenges that we identified were that the data are basically in silos, although they're working on kind of addressing that, spatial resolution, and as well as static formats. Other issues that we also discussed were the timeliness of the data and also data gaps. So the recommendations of our work group were to develop a data user's guide and diagrams that could be put on the national portal, to develop toolkit for state and local grantees to add an HIA toolkit to their portal, as well as provide HIA projects and case studies and communication outreach plans and postcards, which are illustrated there on the right. So here is the current picture of the national portal where health impact assessment lives and can be easily accessible through that link. And this is really kind of the essence of the work that we did. We developed pathway diagrams, which are part of the HIA process, that link the changes that are evaluated in the HIA for a particular project with the exposure and behavioral changes that are associated with that, and then health outcomes. And in the boxes that you see to the right that are underlined are actual data sets that are available on the portal that you can access to inform your HIA as far as baseline health conditions. So as I mentioned, we have state and local portals that have also added either the HIA toolkit or have other data that are available at finer geographical scale, community profiles, as well as maps. So the information, although might not include HIA toolkit, state and local portals can provide some useful information for anyone who's doing an HIA. We identified a number of data users for this, as well as what it can inform, and as you can see, it's just a broad range of information that the portal has really been so useful in doing. As far as general recommendations, at least in terms of environmental health, and we have discussed the fact that there are standardized and well-accepted methods to assess environmental health exposures and risks that could be incorporated into the baseline health assessment of an HIA, and that the information that's on the portal, even with respect to air quality, water quality, et cetera, can actually be incorporated into an HIA, into an environmental assessment. And in the future, the air dispersion modeling that could be included in particularly transportation assessments, including near roadway. And in that regard, there's a lot of work that's being done at US EPA to promote that, including a recently launched model called Sea-Line. And we are working here in Massachusetts on developing the integrated transport and health impact model, which combines both physical activity and air pollution exposures to look at the whole picture in terms of community health. So I mentioned to you that we have an HIA toolkit page on our portal here in Massachusetts. We worked with our Healthy Community Design program on this effort, as well as on a series of HIAs where we incorporated data from our portal. We're also institutionalizing the use of the data and guidance for transportation planning studies, and we provide trainings for local and regional partners. So now I'd like to just mention briefly one of the projects that we worked on where we did incorporate data from the portal. And I'm going to introduce my colleague who's going to follow me in this presentation, Catherine Rattay. She's going to talk about this effort that we undertook to look at how health impact assessment can inform climate action strategies. And this is a report that we had completed with the Pioneer Valley Plan Commission that Catherine works at, as well as two communities in Western Mass, Springfield and Williamsburg. And one of the outcomes of this effort was to actually combine the CDC's BRACE framework, which is Building Resilience Against Climate Effects. It's an adaptive management framework to link climate and health adaptation planning with the health impact assessment. And this HIA that we conducted with those communities kind of tested this approach, and we found it to be successful, and we hope that it can be in the future in terms of bringing stakeholders into the adaptation planning process. And here's a list of our climate change, the baseline health data that we used in our climate change HIA. As you can see, there's a wide range of important data that we were able to incorporate, both that's available on the portal as well as other data sets, and also on the national portal. And Catherine's going to just review that briefly in her presentation. So, Catherine, I'm up to your first slide. Can you see, Catherine, or shall I? You're going to tell me to advance.
Yeah, I still can't see, but can you hear me?
I can, and I have your cover slide, so you just tell me how you'd like me to go.
Okay, so thanks everybody for attending and for giving me some time to share our work. I am from Massachusetts, so I talk very quickly. I guess there's no way for you to tell me to slow down because I can't see the webinar, but I understand that you've all received the health impact assessment report that we did, and that has all the details. And I'm going to talk so fast that there will be time for questions. So slide 2, you can see all the people that we collaborated with on this effort. Obviously, the Department of Public Health, and then, as Margaret said, the Centers for Disease Control. We use their framework, and then our communities and other federal agencies. So slide 3, the screening for our climate change health impact assessment. We looked specifically, obviously, was there a question that we could help answer with a health impact assessment, and we found that yes, there was. So we brought some of the strategies that were included in our regional climate action and clean energy plan to our communities and identified that they had a couple of them that they really wanted to learn more about. So slide 4, our scoping for our pilot health impact assessment. We picked Williamsburg and Springfield because Springfield is our largest community, old industrial city, a gateway city, and then Williamsburg is a small rural town. So they're representative of two pretty significant subsets of communities in the Commonwealth, cities and rural small towns. They're also both mass and motion communities, which in Massachusetts is a program run by the Department of Public Health to promote access to healthy food and physical activity. And then they're also certified green communities, which is another state initiative to promote municipal climate action and reducing energy use. So slide 5 for the scoping, again, we obviously did the standard process, got people together, and they honed in on the 2 specific issues of retrofitting municipal buildings for energy efficiency and location and operation of cooling centers. And so we're just going to talk a little bit about the cooling center piece. So slide 6, these were our research questions for the scoping, looking at the location of the cooling centers, health determinants, and how they can improve what they're doing. Slide 7, you have our wonderful pathway diagram. And again, this is useful for this webinar because all of the data on the health outcomes is available through the state portal. So again, this is how we use our tracking data to inform this health impact assessment. On page 8, slide 8, our scoping assessment, looking at how we got the data together for our baseline. Again, we used all the data from the portal. Number 9, we have how we integrated the health impact assessment process with the BRACE framework that Margaret alluded to earlier, the building resilience against climate effects. And you can see they're quite comparable. And this is a pretty exciting, I think, innovation for CDC and for health impact assessments in this world of climate action. Slide 10, again, is illustrative of why the portal is so useful. So you look at Springfield and Williamsburg, they're very different communities on the surface, but when you look at them and you think, oh, they have a lot of similarities, a similar number of older adults who are living alone, a similar percentage that are older than 65. But then when you hone in on the percent below poverty, suddenly there's, dramatic differences, 27.6% versus 6.7, or percent of those who are of race or ethnicity other than white. So this was really important why the portal was so useful to us in our health impact assessment. Then we have the slide about asthma hospitalizations and ED visits. And again, this shows you why baseline health information is important in identifying the social and health disparities. So we use the environmental public health tracking data to show disparities. And in Massachusetts, we've been doing a lot of work with, obviously, community health improvement plans and understanding how the social determinants of health are affecting health outcomes. Number 12, again, just showing what kind of information that really is useful from the National Environmental Public Health Tracking Portal that really informed our work on this health impact assessment. A lot of people may not realize how much information is available. So again, for us, it was really great to be able to see that the historical and predicted extreme heat days, we could find that. Number 13, our stakeholders asked us to show, to map where are the cooling centers and how do they relate to what climate science is showing us in terms of heat vulnerability. So we were able to map that information, and it does yield a lot of results, which it now is informing where the city and the town locate their cooling centers and how they inform their residents about the availability of the cooling centers. Number 14, looking at our impact assessment. Again, you can look at the report for all the details on that. So we did come up with recommendations. Municipalities should prepare climate action plans. That's not revolutionary anymore. We need to coordinate data and resources, which again is what we're talking about. And obviously the examination of the relationship between poverty, crime, and successful climate adaptation strategies is important. And the power outages is also something to be worried about. And then 16, again, more specific recommendations to the municipalities about where they should put the cooling centers and how they can educate people about it. And then quickly, number 17, just wanting to tell you a little bit about how we did the health impact assessment. We used the tracking data that informed it, and now we're actually applying all that knowledge. So since doing the health impact assessment, we've been fortunate to be able to work with the city of Springfield on their climate action resilience plan. And this climate action resilience plan, because of the health impact assessment, has a real specific focus on social determinants of health and vulnerable populations and social justice, climate justice. The next slide, you can see how the BRACE framework has informed that. And the way the issue of public health really engages a lot more people, it's less controversial than climate action, so we have been able to bring a lot of residents and businesses in Springfield into the fold using the results of the health impact assessment. Number 19, you can see again interdisciplinary collaboration with our grassroots groups, with the Regional Planning Agency, our Public Health Institute, our universities. The next page, we have our Social Justice Foundation defined, which again was informed, if you recall, back from the health impact assessment, and when we were able to use the data to see where the disparities were based on social determinants of health. So again, that's how the health impact assessment has informed us. Number 21, our principals, we're very committed to being open and transparent, making sure that we do the work we always do our work in Spanish and English in Springfield, and that we make a point of including poor, low socioeconomic people and people of color and their legitimate representatives into our planning processes. And the co-benefits obviously are you can see how when we do this focus on the social determinants of health informed from our health impact assessment, we're coming up with more meaningful results. And then finally, the recommendations, again, are informed by how we've been able to use the tracking data. And so that's my information for any follow-up.
Thank you, Catherine and Margaret. I really appreciate you joining us. And I want to remind all the listeners that I have you all in listen-only mode. And if you have questions, please type them into the chat box, and I'll read them out at the end. Our next presenter is Chris Duclos from the Florida Environmental Public Health Tracking Program in Tallahassee. And full disclosure, Chris and I used to work together. So I really appreciate you coming on, Chris, and talking about the HIA on extreme weather.
Great. Thank you, Sandra. Can you hear me okay?
I hear you just fine.
Okay, good. Now, I don't have a presenter control, Sandra, on my screen, although I got the webinar to work
Just
on.
tell me and I'll flip.
Okay. So I just wanted to start off by mentioning that there have been a lot of extreme flooding events the last few years. So Sandra, we're on that one. This doesn't even have the Hurricane Harvey slide in it, which would also be in Texas. The southeast part of the country, Gulf and up to the Atlantic, has experienced a lot of these extreme flooding events. And the one I want to focus on today, and we applied part of the HIA framework to, was in the Pensacola region of northwest Florida. The county is Escambia County, so you'll see me refer to that in a few places. And the report that's on floridatracking.com, it's called the Escambia HIA report. So if you look at our left-hand menu from the EPHT portal, that's where you could find the full PDF, which has a lot more details than I have time for today. So next slide. There's obviously many impacts from extreme flooding. Here's a few of them, from the basic environmental impacts, infrastructure and housing impacts, and then we get into health impacts. And the purpose of us doing this project with Escambia County, we worked with the local health department and the university there, was to try to understand, what happened as a result of this extreme flooding event to public health, and what policies could be in place to minimize the impacts in the future. And I want to focus on basically some injury and hospitalization data when we get to that slide later on. So next slide. Here's what happened. In April, May of 2014, the Pensacola area received about 15 to 20 inches of rainfall, and really most of it occurred in just 2 days. And there were many catastrophic infrastructure failures. The jail there was inundated, led to a natural gas leak, which resulted in an explosion. About 25,000 people were without power. Many roads and bridges were closed, including U.S. highways and interstate highways. Major roads were impacted. And this was quite a severe rainfall event. Next slide. And this shows you, based on the rain or the precipitation monitors in that county, in Escambia County, kind of gives you a surface estimate of, where the extreme rainfall occurred. The southeast part of the county is where Pensacola is. But the next day, April 30th, there were quite a bit of rainfall in the north central part of the county too. And the red outlines are zip codes. We chose that as a unit of analysis. Technically, there's zip code tabulation areas from the U.S. Census, but treating them, roughly the same. And the reason we chose that is because the hospitalization and ED data, the emergency department data in Florida, is only available at the zip code level. We don't have addresses that would get us to census tracts, for example. So next slide. Okay, just a picture of roadway impacts. We could show these from a lot of different areas. I know we've all seen them from Houston, for example, with Hurricane Harvey. Next one. So what we did was we wondered, can you design policies that would prevent and reduce illnesses, injuries, and deaths if such an event were to happen again? And I think we're all kind of in agreement that they are going to happen again. Not necessarily in exactly the same spot, but our purpose at the Florida Department of Health was to learn from this event so that then we could apply this in other parts of our state and work with local agencies to try to design policies that would minimize the impacts. In this case, we worked with the Florida Department of Health in Escambia County and the University of West Florida. The next slide. We basically assembled environmental and health data, part of the scoping and assessment. We determined the zip codes most impacted by the flooding based on rainfall monitors and damage reports. We established the dates of the impact period, which again, you could go back to the rainfall record. You could check local media. These are the things we did to kind of establish what we called the impact period. And then, the cleanup and resulting impacts varied a little bit by health outcome. So, for example, respiratory impacts, you could count the cleanup period where people are working on their homes, they're being exposed to mold. We actually went out 60 days for that one, but the impact period varied a little bit. Just a couple of days for some of the impacts we measured out to 60 days for the respiratory. And we worked with an epidemiologist here to perform a case control study comparing the impacts from this extreme rainfall event to a very similar year without flooding, which is 2008. So next slide. So this slide shows the proportion of hospitalizations and ED visits for all-cause injury, and the results by zip code were really mixed. But for overall, the county did see a slight increase in the event plus the 4-day period. This is the hospitalization ED visits for respiratory disease. And again, there was a slight increase for the overall county, but the zip codes were really mixed. What this means is those tables basically show the proportion of the visits to a hospital in ED as a result of injuries and, on the other hand, respiratory illness. And so the reason we chose to go with proportions is because hospital and ED utilization in Florida has been going up through time. And so to compare the year 2014 to the year 2008, we really had to sort of come up with this proportional idea, what percentage of the visits in 2014 could be attributed or were assigned to these two types of health outcome sources, what happened in 2008. But that's what the tables explain. The maths really show you the percent change, between those 2 years. And, again, the results were kind of mixed by zip code. Some saw increases and some saw decreases. So this particular map shows the location of sewage lift station failures, and some of those sewage lift stations are located in the 100-year floodplain, which definitely shows you where the flooding occurred during this event, where it was concentrated. And one of the things that we realized was that when the sewage lift station gets inundated, the electric panel gets flooded and it stops pumping. And so then you have the sewage overflows, which could potentially expose people to, bacteria, definitely an environmental impact to local waterways. And so one of our strongest policy recommendations was to raise electric panels on these sewage lift stations above the flood elevation. And Sandra, the next slide, I think, has a picture of what that looks like. This is a sewage lift station where the electric panel is on stilts. It's raised up. It only looks like maybe 4 or 5 feet, but it's above what the anticipated flood elevation is going to be. And this sewage lift station can continue to work. Even though the surface of the ground will be covered in water, if it still has electricity, it will continue pumping through the pipes to keep the sewage overflow from occurring. So, we included this as a part of our report, and the local authorities there were very glad to see the health department was behind containing the sewage overflows, that would likely happen again should this area flood again. There were other recommendations centering around, really promoting the CDC guidelines for cleanup, including, being careful around mold cleanup. And then the construction and demolition from debris, the cleaning of debris from a big event like this is really problematic to store. In Florida, you can have lower standards for construction and demolition because it's sort of considered an inert material. It's not really supposed to contaminate the surrounding environment. But when it breaks down in a hot and humid environment, the gypsum wallboard in particular releases hydrogen sulfide. And so the smell, and if those levels get really high, there's health impacts too. That can be a problem. And so we want to strengthen local policies to adequately cover that material and dispose of it in a way that it's not getting soaked by rain and exposing surrounding communities to hydrogen sulfide. So, Sandra, I think that might have been it. Yeah, after the sewage station. Oh, just some acknowledgments for the HIA team. Margaret, the excellent work done out of CDC in the States. It's really helped to push the science along when it comes to HIAs. And while I realize our example is not a classic HIA where a lot of screening and scoping were done beforehand, we really wanted to apply some of the same principles to extreme weather events with the hope of designing policies that will, protect public health better in the future. And so I also want to acknowledge the local people in Escambia County, as well as epidemiologists Melissa Jordan and Christina Kensiger. So I think that's it, except for my contact information. And again, the report is at floridatracking.com. If you look in the left-hand menu for Escambia HIA report, there's a long PDF of this project. So thank you all.
Thank you, Chris. I really appreciate you coming on, and we've got some questions. So I'm going to go to our final but very important speaker, Jesse Schmuel from the Minnesota Tracking Program. Jesse, are you on?
Yep, I'm here. Can you hear me?
Yes, ma'am, I can hear you. Can you click or do you need me to click?
I have control.
Yep, you got it.
Great.
Thank you.
Okay, hi
Take
everyone.
It away,
Thanks. So I'm Jessie Schmuel from the Minnesota Department of Health, and I'm going to talk about two HIAs that we completed that use tracking data specifically in the scoping phase, and these were HIAs focused on transportation-related plans or policy questions. So in the Minnesota Department of Health, I just wanted to give you an overview of how we work on HIAs. We have an HIA initiative that works out of our Environmental Health Division, and their goal is to build local and statewide capacity to evaluate the health impacts and influence outcomes of various plans, projects, and policies. They both conduct HIAs and provide technical assistance to partners, as well as providing resources and training to HIA practitioners from a variety of sectors. They convene our Minnesota HIA Coalition, which has been a great opportunity for the tracking program to keep HIA practitioners updated when we have new data, when we have new tools, and to make our services known. So in Minnesota, we have about 34, our HIA initiative counts 34 in progress or completed HIAs, most of which have been on transportation or built environment projects and plans. Where the Minnesota Tracking Program fits in is we, like all of the grantees, we develop and analyze data on environmental hazard, exposure, and health topics. We have over 20 topics on our portal. Our role is that we provide those data through our online data portal. We also perform custom data requests. When we look at our, over the past few years and the data requests that we get for data that are, maybe somebody wants it a little bit different way than it's available on our portal. Maybe they want it broken down by a different age group or different geographic resolution. When we look across, about a third of our requests are for HIA projects. Part of that is also providing environmental health and epidemiology expertise. Like you saw in the examples before from Florida and Massachusetts, there's a lot of thinking about whether it's going to be a proportion versus a rate or what makes sense and how to do those statistical for a comparison area, whether it's higher or lower than the state. That's part of what we offer to the HIA practitioners. And we also listen to folks who are requesting data and what types of data they need to get their HIAs done. And then we work to try to develop new data and respond to those needs. So again, I'm going to talk about two transportation-related HIAs. One really big, really statewide, that was multiple agencies on our Department of Transportation statewide multimodal transportation plan, and that was carried out, conducted by our MDH colleagues using tracking data. And then another one that was very local, very specific to a highway in Bemidji, which is a city in northern Minnesota. For both of these HIAs, I'll just talk a little bit about the issue, who was the HIA team and what they were trying to accomplish, how tracking data were used in the scoping phase, and what happened as a result. So the statewide multimodal transportation plan is the highest level of transportation planning that our State Department of Transportation does. The goal of this HIA was to really ground the plan revision in how social and physical environments contribute to shaping health. So we've heard about how social determinants are so grounding for all of HIA work. And what was really interesting about this HIA is they made explicit connections to how transportation in particular and how transportation systems influence our ability to access many of those factors that determine health, social determinants. And so the team consisted of our HIA initiative and folks at the Minnesota Department of Transportation, along with local public health and a range of community stakeholders. This partnership was basically the first next step in an interagency agreement in 2015, where health and transportation together came up with a vision of instilling health in all policies to improve health through transportation system changes. So this was a very exciting first step in making sure that health was being considered in transportation planning. So in the scoping phase of the plan, they took a very broad view of what creates health. And so we had a lot of indicators from the tracking network that were included in the scoping phase, including a range of chronic conditions, respiratory and cardiovascular. It also included birth outcomes, obesity, and heat-related illness. On the right map, you can see that these are zip code level rates of asthma hospitalization, and they overlaid all of the maps that went into the scoping phase have the highways and interstates overlaid on these health outcomes, just to provide that visual reference in the scoping process. One of the things they did that was really important to bring in the social determinants focus through the HIA was they included health disparities in addition to just the overall health conditions in their scoping phase. So they were able to prioritize and focus based on disparities and how those varied across the state, in addition to how the absolute health burden kind of varied geographically across the state. They included a range of other important data that were not through the tracking program, including demographics, population growth projections, commuting behavior, food environment, and a range of other things. So they really took a very broad view in this scoping phase. So what happened was you can see there's the report down at the bottom of the page linked, and that includes all of the 21 recommendations, and they were focused on supporting safety both for pedestrians and riders or drivers in the transportation system. They focused on community health, and they really centered a lot of the recommendations on health and economic resource equity. Some of in the evaluation of the team members, both folks at the Department of Transportation, as well as stakeholders and local agencies and community groups, some of the outcomes that they thought that the tracking data and the HIA brought to the process were really reframing and providing support for talking about health equity in their plan strategies and priorities. It fostered engagement especially for the Department of Transportation, with a wide spectrum of stakeholders that they would not have otherwise or had not previously engaged in their transportation planning. It really strengthened the agency commitment to equity, and it was a good demonstration for us in the state for these kind of cross-agency collaborations. So we'll see what actually happens and what when we're in our bonding year. So we'll see what projects get funded that were recommended out of the transportation plan. Okay, I'm advancing. Okay, so the second HIA was smaller in scale and focus. Bemidji is kind of a smaller city in northern Minnesota, and they local community members, state and local regulators, planners, and health professionals were concerned and saw an opportunity for an HIA because they know that this Highway 197 that just goes right through the heart of Bemidji was going to be the focus of some redevelopment or restructuring. The highway was originally designed for cars and trucks to pass through the city, but over the years, the traffic volume has increased such that it's created a lot of health and safety concerns for the adjacent residential areas as well as businesses on that 197 corridor. So the goal of this HIA was to examine how future road design modifications and plans could impact the health of residents, workers, and visitors to the city. The data from the tracking network that went into their scoping process was specifically focused on cardiovascular health indicators. They wanted to focus there because they knew that these were linked with traffic-related air pollution and chronic disease disparities. So we provided zip code level asthma, heart attack, and COPD hospitalization ED visit data. And we provided, again, a comparison for those zip codes right in the heart of Bemidji that were impacted by the highway to the county and state rates. Additional data that they considered included demographic and some built environment indicators from outside the tracking network. What we found was that the cardiovascular health indicators for residents in that in that zip code were similar to the county and state rates, and that they did not indicate geographic or social disparities. So this HIA really focused their recommendations on safety and physical activity modifications. And that was a really good outcome, even though the cardiovascular data, those indicators that came from the tracking program were not ultimately carried forward into the future stages of the HIAs. It allowed that group, that scoping phase, really allowed them to focus their limited resources on those other pressing concerns around traffic safety and physical activity. And so that was a really good outcome for focusing and narrowing the HIA. Some of the recommendations that they now have for future planning processes are around promoting connectivity and traffic calming to reduce collisions and increase safety. They want modifications that encourage physical activity for residents of all ages and abilities, and they want to reduce air pollutants through less car-dependent neighborhoods. There was another great outcome of this was that key members of the HIA group, including the city planners, engineers, and community members, continued to work together on this to keep collecting information and evaluate interventions in the 197 corridor. So that was a partnership and a team that continues to work on these issues locally. Some of our reflections about how tracking data has informed the scoping phase of these transportation-related HIAs is that, the data can target those really specific concerns, or like in the Department of Transportation HIA, really just encompass a broad set of indicators as well as disparities. Important especially in the multimodal Department of Transportation HIA were both the qualitative and quantitative comparisons. So again, we calculated for them statistical differences between local and versus statewide rates, for example. But there was a lot of qualitative information from stakeholder processes that were equally important in that scoping phase. So how our tracking partners can, or how we can respond to the needs of HIA practitioners through those data requests, through that expertise, and through creating new indicators. One example was we had repeated requests for traffic exposure indicators, so not just different from what would be the density of traffic in a given area. So we created and launched on our portal last year an indicator of census tract level population exposures in that near roadway environment. So that's the proportion of a population that is living within 300 meters of a busy road. So that was a great outcome for us as well. And that, I think I've covered everything. So that's my contact information. And again, the link for the statewide plan was in my slides. And so that's all I have.
Thank you, Jesse. And I really want to thank all of our speakers. And we've had a couple of questions come in the chat box, and I'll toss this one to Chris, and then each of you take a shot at it. Do you recommend any HIA training specifically for tracking funded states?
Yeah, I believe Margaret referred to the HIA toolkit on the EPHT national portal. I would definitely start there because it also has links to other resources that are really helpful.
Other recommendations from the panel?
And I would just say that one of the things that we advanced in our first pilot HIA transportation study is that human impact partners, and they're mentioned early in my slide as one of the pioneers in this area of HIA, came and did a training for the stakeholders that were involved in the HIA, and I have to say that it was moved mountains in terms of bringing people from different walks of life, different disciplines, different understanding of what even health is and how it's defined together, and identifying and basically going through the scoping process. And we found that to be tremendously useful. So I think that that's also perhaps someone would like to consider something along those lines if they were doing a big HIA and they had a real broad stakeholder process, which of course is a good thing.
Thanks, Chris and Margaret. And this is Sandra. I just wanted to let you know that NEHA does do health impact assessment classes. So if you're interested in specifically on-site training, you can contact me directly. Go ahead, Chris.
I was just going to say we had a good experience with that here, Sandra.
Thank you. I'm glad it was helpful. I really enjoyed it. This is for Margaret. Has the Massachusetts Department of Public Health incorporated HIA into their state version of NEPA?
Good question. Hi, Nancy. I think we haven't formally done that, so let me just quickly mention that in 2009 we have transportation reform law that has had a section of it that required health impact assessments as part of the transportation decisions. And so we've been working with our partners in the state agencies as well as local, and other groups to implement that. As far as actually having requirements in our MIPA, which is what we call it here in Massachusetts, they're not specific requirements, but let me go back to one example that I had mentioned earlier. In that first pilot HIA that we did under the transportation reform, which was the Grounding McGrath health impact assessment, it was a transportation study of McGrath Highway in Somerville, and they were looking to ground, if you will, quote unquote, the viaduct, and we did a health impact assessment around that. That has subsequently went into a project, and their environmental impact assessment and related NEPA requirements did address the findings of the HIA in that process. So I would say that while it's not specified in the MEPA requirements overall, that HIAs that have been done for projects that undergo MEPA review have had the opportunity to incorporate that information into that process.
Thanks, Margaret. I don't have any other questions typed into the chat box, but does anyone on the panel want to add anything, or was there something that you wanted to elucidate? We have about 5 minutes.
I'll just add, I know I made this point earlier, but I would like to, since my home is environmental health, reiterate how the work that we have done that has in environmental health and in looking at particularly air pollution, water quality, other exposure assessments, the advancements that we've made in that area are really something that can be fairly easily incorporated into an HIA, and I think that it requires us to be more involved in that HIA process because it can be overlooked. There are times when an HIA is conducted, and if the environmental health contact is not involved in it, then that information isn't necessarily brought on. And now that we have the environmental public health tracking portal, it even makes it easier for that process. So I hope that people are encouraged to, if there is an HIA and this is an area that you have experience and expertise, that you feel comfortable joining and making recommendations on including environmental health data in the HIA process.
Thanks. I want to thank everybody again for attending. This webinar is approved for HIA CEs. If you are a credential holder, email me and I will send you the form to fill out for this. You'll get 1 credit hour. And thank you again to our wonderful speakers, Catherine, Margaret, Jesse, and Chris. Really appreciate you coming on. And thank you to everyone for attending the webinar. Have a great day.
Thank you.